working on that. So let's look at the thoracic cavity. The structure of the thoracic wall, we already have covered that one in either one of the PowerPoints that was labeled. And so we're going to go inside the thoracic cavity and look at important features of the thoracic cavity whilst they are still in the mediastinum. Okay, so at this point what we have done, we have broken the ribs already along the line where the ribs are attached to the vertebrae, cleaned up this area a little bit, which is right in front of the first rib, and we can see there is little extension of the thoracic, or let's say pleural cavity in front of the first rib. That is going to be your cupula pleurae. The cupula usually would be present on both sides, in the left thoracic cavity as well as on the right. Then what we did, we transected the costal cartilages slightly away from the midline so we can retain the structure on the floor of the thoracic cavity. As we reflect the thoracic wall, caudally we have cut it along the line or along the attachments of the diaphragm to the costal to the thoracic wall along the costochondral junctions. It may not be exactly at the costochondral junctions, but slightly behind that. So we have, these are the costochondral junction right here, attachment of the diaphragm, costochondral junction, attachment of the diaphragm along that line. So here we see some of the empty space which might even extend further down here. The lungs are never going to reach that space here, that is called costodiaphragmatic recess. Okay, we'll come back to that structure a little later, but then let's look at the layers of the thoracic wall as we see them from this view. We see the layer or serous membrane which covers the thoracic wall right here. As it is present along the costa or along the ribs, it is your costal pleura, which basically is the parietal pleura. Then we see the pleura which is present on the lung, which is pulmonary pleura or visceral pleura. In the thoracic cavity, except the pulmonary pleura or pleura which is present on the lung, everything else is the parietal pleura. Okay? So here we have the costal pleura, diaphragmatic pleura, visceral pleura which is present on the lung. As I lift up the lung a little bit, we can see the pleura covering the pericardial sac, that is your pericardial pleura. Here we have the cranial mediastinal pleura, as it forms the mediastinum in the cranial part of the thoracic cavity. As we go a little bit backward, we can see the caudal part of the mediastinum, which is slightly on the left as compared to the median plane, which is present in the cranial part of the mediastinum. Okay, so we're going to remove the lungs very soon. We see the basal border of the lung. Just note that this is not the actual basal border in the live animal because the lung in this state is completely collapsed. We see the oblique fissure of the lung. We see the interlobar fissure of the left lung, the base and the apex of the lung, the dorsal border, the basal border, the ventral border, the acute border. Apex of the lung almost extending into the cupula pleurae, should be on both sides. Okay. After this, we are going to look at some of the blood vessels along the floor of the thoracic cavity. Okay, so we'll remove the lung, we'll look at the structure of the lung, and then we go back to the thoracic cavity again. So here we are removing the left lung of the dog. We already have transected the root, so we can easily take it out and flip it and see the medial side of the lung. So we turn it around, and now we flipped it to the medial side of the lung, and we see some of the impressions of different organs on the medial surface of the left lung. Okay, let's turn it around and then look at the lung as it is isolated. So it should be in this form or in this orientation in the thoracic cavity, with the dorsal border, basal border, ventral border, apex, and the base of the lung. Oblique fissure dividing the left lung into caudal lobe and the cranial lobe. The interlobar fissure dividing the cranial lobe of the lung into cranial and caudal parts. Not the lobes, but only cranial and caudal parts. So this is cranial part of the cranial lobe and the caudal part of the cranial lobe of the left lung. Okay, we're now turning it to the medial aspect. So we flip the lung over. That is impression of the aorta. We can see the aorta going backward. There's your aortic arch, and then from aortic arch, as it is moving backward, it leaves an impression of the aortic arch as well as the descending aorta on the lung, specifically on the left side or on the left medial surface of the left lung. Then this is the impression of the heart, but this is not so deep that it will cause or it will form the cardiac notch on the left side. Then we still see the oblique fissure, the interlobar fissure, impression of the diaphragm, which is also called diaphragmatic surface, the mediastinal surface or medial surface and the diaphragmatic surface. You can see that concave impression of the diaphragm as diaphragm projects into the thoracic cavity. That impression is on the lung as well. Okay, while cutting off the lung or while removing the lung from the thoracic cavity, we cut it through the root of the lung, where the structures or the aggregate of the structures which are either going into or coming out of the lung, as well as we had to cut the pulmonary ligament which attaches the caudal lobe of the lung to the mediastinum. Okay, so we cut the pulmonary ligament, we cut the root of the lung in order to take out the lung from the thoracic cavity. Hilus, through which the structures are passing through. So we see the pulmonary artery on that side. We should have the other one going to the right lung. Then we have the primary bronchus dividing into secondary bronchi. Then we have pulmonary veins draining blood into the left atrium. Okay, so these are the structures which we would see in the lung on the medial aspect. The lateral surface, we see impressions of the ribs because that is the costal surface. Okay. Base, apex, dorsal and different borders of the lung. As we look at the thoracic wall, on the caudal surface of every rib, we're going to observe the intercostal artery, vein and nerve. The one which is injected in blue latex, that is your vein, artery and nerve. And that actually follows a specific order. The order is VAN. Vein being the cranial most, artery being in the middle, and the nerve located at the caudal most aspect. So again we can see the intercostal nerve, intercostal artery, intercostal vein. So the order from cranial to caudal is VAN. Okay, at this point we are looking at the dorsal intercostal arteries as well as the dorsal intercostal veins. The nerves could simply be intercostal nerves because they are not actually coming from the ventral or dorsal side. They are only derived from the ventral branches of these thoracic spinal nerves. So they are coming from the top going towards the bottom. While arteries, they derive from the top as well as from the bottom. So what we have from the ventral aspect, we have ventral intercostal arteries and ventral intercostal veins. The anastomose with dorsal intercostal arteries and dorsal intercostal veins. The costal pleura, the diaphragmatic pleura, the mediastinal pleura. Now the mediastinal pleura, depending upon the regions of the mediastinum, has been further divided as cranial mediastinal pleura, which is located right here, which encloses your thymus gland within the mediastinum. Also includes your left subclavian artery, descending aorta, entire heart, most of the trachea, as long as it is as part of the trachea which is present in the thoracic cavity. The larger veins located in the cranial aspect, all of those are also enclosed within the mediastinum. And we see the vagus nerve running along the lateral surface of the aortic arch as well as the aorta. We see the phrenic nerve going backward towards the diaphragm running along the lateral surface of the heart. Then we see the heart located obliquely. The base is more cranial while the apex is located more caudally, and the long axis of the heart would make almost angle of 45 degrees with the sternum. Remember, in the cat this is going to be more oblique than in the dog. Okay, so let's come back to the structures of the thoracic cavity now. So what we see here, that is your left subclavian artery, that is the arch of the aorta. As we probably dig a little bit deeper, then we're going to find the arch of the aorta. This is the descending aorta which is going backward. Now we'll look at those structures step by step. So first of all, let's look at the aorta and the left subclavian artery. Then we'll look at the vagus nerve and the phrenic nerves. Okay, so here we have the left subclavian artery. In the dog, the left subclavian comes off directly the aorta. So it is direct branch of the aorta, which continues further cranially and would be responsible for the left forelimb, part of the left thoracic wall, part on the lower part of the sternum, or part of the left thoracic wall on the lower aspect as well as it will give off your superficial cervical artery, which is responsible for chordodorsal as well as chordoventral part of the neck, as well as it has the vertebral artery, which is responsible for the vertebrae on that side. Okay, so let's look at 4 major branches of the left subclavian, and we will compare those with the right subclavian when we look at the right subclavian artery. So the left subclavian, here we have transected the costocervical vein in order to expose, or in order to make sure that we see the left subclavian artery more clearly. So this is left subclavian. Continuing further, that is a loop formed by the sympathetic trunk, that is your ansa subclavia. Right after that, we have the major blood vessel coming off the left subclavian, that is the costocervical trunk. From the costocervical trunk, we have the costal, which gives rise to first 3 or sometimes 4 dorsal intercostal arteries, and then it will continue towards the neck as well. Then we have, even before that actually, artery which is located slightly deeper. We will have to expose that in order to try to pull it out a little bit. That is the vertebral artery, which is also a branch of the left subclavian. So we saw the vertebral artery, costocervical trunk, a small branch for the first 4 ribs, again going on the medial aspect of the thoracic wall. Then we have the superficial cervical artery. Then we have the internal thoracic artery. From the internal thoracic, you also see a small branch given to the thymus. Internal thoracic then would continue further on the floor of the sternum. We can see that blood vessel right here. Along the floor of the sternum, we have the internal thoracic artery as well as internal thoracic vein. They are running together. The internal thoracic artery then would further give off branches on the caudal surface of the rib, running along the costal cartilage first, and then it will anastomose with the dorsal intercostal artery. Those are the ventral intercostal arteries, and also we see the veins at the same point. So we have the ventral intercostal artery and vein located here. Both of them, the artery is coming off the internal thoracic, while vein is going into the internal thoracic vein. Usually both of them would be covered by the transversus thoracis muscle, which is located on the floor of the thoracic cavity. So that is your transversus thoracis muscle covering the internal thoracic artery and internal thoracic vein. The internal thoracic artery would further continue. Here it will go along the costal arch. The branch which comes along the costal arch is your musculophrenic artery, and after giving up that branch, it continues on the outer surface of the internal abdominal oblique muscle, that is your caudal epigastric artery. Now this is going along the abdominal wall, and so this is your cranial epigastric artery, that is the cranial epigastric, and a branch of the cranial epigastric which comes further superficial is your cranial superficial epigastric. Remember, this blood vessel is responsible for blood supply to the mamma in that particular region. So the cranial superficial epigastric blood vessel, as we are looking at the male, blood vessel is not as developed as it would be in the female. It's your cranial epigastric, and that is your cranial superficial epigastric. Okay, so other branches coming off the internal thoracic, we have the perforating branches of the internal thoracic artery, perforating branch of the internal thoracic artery, perforating branch of the internal thoracic vein going into the